So we are going to hear from an excellent speaker this morning. We're very fortunate to have our speaker here with us. But before we begin, I just wanted to do a few announcements. First of all, just a plug for next week's Grand Rounds. Our speaker is going to be Katerina Schmeck, who is the clinical science group leader from the Francis Crick Institute and the University College of London. And her talk is titled Hallucinating Mice, Dopamine and Immunity Towards Mechanistic Treatment Targets for Psychotic Disorders. So it sounds like an extremely interesting talk. And now I want to turn it over to our new interim chair of psychiatry, Dr. Blair Simpson, and also Dr. Thomas Smith, Chief Medical Officer for New York State OMH, who are going to say a few words in the wake of Dr. Lieberman's departure. Blair, over to you.
Hi, thank you, Kate. Hello, every morning, everybody in the department. I'm Blair Simpson, and this week I was appointed interim chair of the department, and I'm honored and also very humbled to serve you on the department at this time. It's also a very unfortunate circumstance because I was scheduled many weeks ago to deliver Grand Rounds at Cornell in this exact same slot. So I asked our chair over there, Francis Lee, could I have a few minutes just to sort of present myself here? And first of all, to say incredible congratulations to Dr. Maggie Alegria on the Mumford Award. So well deserved for her incredible work. And I'm so sorry to miss the talk, but I'm looking forward to listening to the recording. This is very exciting. And I also want to congratulate Dr. Jean Marie Bradford, who won the Martha Hooven Award for Excellence in Diversity, and that was celebrated last month. And I just want to make a public announcement about it. Please know that next Monday on the 7th, from 11 to 12, I'll host a forum where I'll talk to the department, all staff and faculty in the department, and also have the great pleasure to introduce the new Dean of the Faculties of Health and Sciences and the Vagelos College of Physicians and Surgeons, Dr. Katrina Armstrong, who will also speak. And Tom will be there, and we're hoping maybe Ann Sullivan will be there. So I please hope you will join us, and you'll get the announcement very soon. So with that, I'm going to turn it over to Tom, and congratulations, Maggie Alegria, so well deserved.
Thank you.
Thanks, Blair. Oh, she left, but I just wanted to congratulate Blair again and let her know how delighted we are that she's in this role. And everyone, please join me in welcoming and congratulating Blair. We're very happy. And yes, there will be an announcement next Monday. We'll confirm the details. The dean, as of now, we are anticipating that the dean will be here, Dean Armstrong. Our commissioner will be here. And in fact, being here means more than just Zoom. I think we're all going to be live, probably in the auditorium. I think that's the plan. So if anyone plans to be on site, we'll have to put out some information about the seating regulations in the auditorium. But I think that's what we're going to try to do, is have an in-person welcoming event on Monday. So more to come on that. It's been a humbling week for all of us. I want to thank everyone for attending the town halls. We had 4 town halls that were forums for faculty and staff to express their thoughts and concerns and opinions about how best to move forward. We heard a lot of fantastic ideas. We're going to try to take them all into consideration and begin a process of taking that information and working with you, with our department and our staff on appropriate next steps. So we're in a period of reflection right now, but we're committed to moving forward the way we do with everything here, with a sense of commitment and zeal and passion to not only understand what's going on, but to figure out how to address things and figure out how to be the best at it, because that's what we do. So in that spirit, and I think today's Grand Rounds is a great event to hand this over to. So in that spirit, I will turn it back to Kate. Are you muted, Kate?
I am, thank you. Thank you, Dr. Smith. So for today's Gone Rounds, I'm going to turn it over to Dr. Dixon to introduce our speaker, Dr. Alegria. But before I do, I'm reluctant to give up the mic this morning. I just want to make a brief reminder that we encourage everyone to post questions at any time during the talk using the Q&A feature at the bottom of the Zoom window. It's separate from the chat. And if you're a trainee, please put the word trainee at the beginning of your question. We've also begun compiling a list of potential speakers for the upcoming academic year, and we always ask for your input. We aim to have a diverse list of speakers that covers topics from basic and clinical science, implementation, and education. If you can fill out our survey with at least one nomination or pass along to members of your respective research and clinical groups, we would really greatly appreciate it. The survey link is permanent and is consistently monitored throughout the year. And if you have any other speakers over time, please continue to add names for future dates. We value your input. We value the input of our department members. And thank you all in advance. So now over to Dr. Dixon.
Thank you so much. And I feel so privileged to be here and introduce the winner of the Mumford Award for this year. Actually, it was from 2020, but 2021, we're a little delayed. So I just want to say a word about Dr. Mumford and what this award means. She was a sociologist and professor of clinical socio-medical sciences in psychiatry and public health and at the College of Physicians and Surgeons at Columbia University, and chief of the Division of Health Utilization and Policy Research at the New York State Psychiatric Institute. And that's a mouthful, a lot of 3-4 syllable words. What does that mean? She stressed the human side of medical care and the importance of the social and cultural context. She placed special importance on the relationship between the clinician and the patient and on the role of the family in healthcare. She also studied economic dimensions of health and mental health care. This lectureship is founded to preserve Emily Mumford's interest in the contribution of social sciences to medicine. And I think our speaker and this year's award winner is just an exemplary winner, an example of someone who has dedicated her career to challenging us and challenging the field to do better and reduce disparities. So I'll just say, I know you're not here to listen to me, but I want to just give a little bit of her background. And I'm not going to mention the 305,000 articles that she's written and all the awards that she's won and all the grants that she's gotten. I'm not going to say that, okay? But I will just give a little bit about her background. So she received her bachelor's degree in psychology from Georgetown University and her master's in psychology from the University of Puerto Rico. She then received her PhD in psychology from Temple University in Philly. And in 1982, she started as an instructor in the Department of Health Services Administration, Graduate School of Public Health. So this is, public health, University of Puerto Rico. And she rose to the rank of professor by 1998. In 2002, she started as a visiting professor at Harvard Medical School. And in 2004, she stopped being a visitor. She just dropped the visitor piece and just started living there. And she was simply a professor, first at the Department of Psychiatry and then also in the Department of Medicine in 2016. And at the moment, she is the chief of the Disparities Research Unit at Massachusetts General Hospital and the Morgan Institute. And I'm going to conclude by just speaking some of her own words, which then she will fortunately continue. But I think I wanted to give her words in how she summarizes her focus and her interest. I remain dedicated to generating knowledge that can be used to increase equity in health outcomes and healthcare services for disadvantaged and minority populations. My research has integrated 3 methods. So she's a very rigorous scientist: a multidisciplinary and multisectorial approach to research, a multi-level framework which gives necessary consideration to environmental and social context, the individual and family system, and a strong focus on which aspects of culture and context need to be addressed to improve health as well as service delivery for diverse populations. I think Dr. Mumford would have been a big fan of Dr. Alegria. So really eager to hear your talk. Thank you so much.
Thank you so much, Lisa. Thank you so much. I'm very honored by getting this award. And I want to first start my talk by just saying, I want to thank the awards committee and Lisa, obviously, because the roster of people that have been awardees of this award, it's just amazing. A lot of people that I highly respect. But more importantly, when I read about Dr. Mumford, I actually went also and looked her up, and I was like, oh my God, this is such an amazing award to represent, her in life. And so I wanted to also thank, I want to start by thanking my husband, who's in the probably in the group, who was also an awardee of the Mumford Award. I think we might be one of the few couples that both have received this award. And I want to thank him because he puts up with my passion for working this area and for really being willing to sacrifice time from him and from the family to do my work. And then I also want to start, and I'll just start sharing because I want to thank my team. So let me start this is a very emotional time in thinking about the topic that I'll be talking and discussing. I wanted to talk about disparities for youth of color. And as I said before, I have no conflicts to disclose, but I want to recognize that this is all my work is really a team effort. It's all by the people you see here, and these are not all. We have 24 people in the unit, and they represent different perspectives, different disciplines, but they're all inspired by trying to achieve equity. And so I thank them for being part of what we do. I know that this is, people will ask, why am I focusing on the mental health of youth and young adults of color? And I wanted to start that I typically have done more work on adults and on older adults too, but I've really become very passionate about doing something about young adults, particularly because of all the things that are happening today. And I hope my slides, we can move my slides. Let me see. So I know that people talk a lot about diversity, but we don't necessarily walk the talk. I love Maya Angelou, so I use this quote from her, that we all know that diversity makes for a rich tapestry, and we must understand that all the threads of the tapestry are equal in value, no matter their color. But unfortunately, we're not there yet. I want to show you the importance of getting there, because if you look here, the changing demographics of this country for youth, these are children under age 18, it's exponentially changing. You can see here 2016, and you can see here 2060. And as you can see, the very light purple is the non-Hispanic whites. The darker purple is Hispanic. The more light, darker is Black youth. All others are the green, and then the dark green is the Asians. But as you can see, we're becoming, basically youth are the global majority. The ethnic minoritized youth are the global majority. But I also want to show you a trend that's happening that's really dramatic in terms of the 2020 census. And it's, if you look to the left, you'll see the percent of the population under 18. And there's a huge increase, a tripling of youth of 2 or more races. And you can see also the big amount of Latinx youth that we will have in this country. I was very fortunate to actually be in as part of the Promise of Adolescent. This was a National Academy of Science consensus report where we actually looked at what can we do to help youth flourish in this country, realize the opportunity for all. And I want to start by using this quote that was at the beginning of our commentary, which talks about the importance of understanding one's capacity to affect the world are all the processes that begin to know oneself and affect the capacity to affect the world are all processes that begin to take shape during adolescence. So you can see here that minoritized status may make this task more difficult to define one way in the complicated life that we lead today. I also want to make a distinction because we're changing our language to better capture the ideas behind what we think is happening. We have called this groups minority, but there's a difference between being called a minority and being minoritized. And now we really talk about minoritized youth as the important aspect that we want to focus on. Minority status is a social construct. We make it up, but it typically has represented both a mathematical minority, but it's also used to differentiate people based on culture, skin color, their accent, or by their affiliation with a group with limited political, economic, or social power. However, minoritization is the social process in which minority racial ethnic groups experience those exclusionary practices of more dominant groups that happen because of historical and contemporary racism with the object of becoming minoritized. So I want to make the distinction that we attribute the minority to them, but it's really that we're minoritizing them. When youth grow, I've been very interested in context, as you've seen from my work for all these years. And I was very interested in how the minoritized context versus the majority context make differences in how youth develop. There's quite a lot of evidence that whether youth develops in a majority versus a minority context might change how they perceive their self-worth, the group stereotypes that they acquire, but interesting, it also is tied to potentially traumatic or adverse events. And as a result of that, many of the minoritized youth feel they have less control of their lives. I want to bring you also to what's happening in this country that was recently acknowledged by the US Surgeon General's advisory on having really a mental health crisis in this country, especially for adolescents. We know that the increase in suicide attempts, people going to emergency room visits for suicide attempts since the pandemic broke, before the pandemic, has gone 51% higher for girls as compared to 2019. Imagine the huge amount of youth girls that are going to emergency care because of suicide, and 4% higher for boys. And we know that many of these youth were minoritized adolescents. I also want to raise attention to yesterday's President Biden's federal approach to mental health crisis. I'm definitely not going to touch upon it, but he really understands the importance of paying attention to this mental health crisis with really strengthening system capacity, with connecting Americans to care, and for creating healthy environments, which is something that I'll be talking for the whole talk today. There are several things that, caution us of how serious is this mental health crisis. This is a study that's just recently published about a national survey of thousands of high school students. What they found is that nearly 72% of the students are reporting decreased mental well-being. And this is striking because we're talking about almost 3/4 of youth talking they're not doing as well in terms of their well-being. The study also showed that Latinx were the ones most likely to experience poor mental health. And it also showed that compared to white youth, Latinx youth were 60% more likely to report poor health. Tied to this, we see a recent report that just came out by hand showing how we have very high rate of suicide by intentional overdose of either a medication or a drug that typically has decreased overall, but there has been an observed increase for young people, those 15 to 24. And this is a group that I think we have to raise the alarm bells. Especially non-Hispanic Black women were showing very high in terms of this rates. And I want to again say, this is not race, this is racism that's probably making these differences occur. I want to show you another study that was done on disparities in outcomes for multiracial youth. This was a study of 4,766 high schoolers. And what it found is multiracial youth seem to have higher levels of mental health issues as compared to their majority peers or monoracial peers, suggesting that this is an area that we need to attend. And then also Mark Olson's work here shows that at the same time we're having those increases in terms of showing more problems in terms of mental health, we are also having some slight increases in terms of youth seeking care, particularly girls, as shown here by the work of Mojave and Olson, but a decrease in boys. And I'm really concerned about particularly boys of color in terms of not doing a good job of offering care that they feel is worth looking for. This is a study that SAMHSA did. And the only reason I want to present the study is to show you that most of the care is still provided at the specialty mental health setting and at the education setting, but these rates have not really gone up compared to the need. I show you an increasing need, but not necessarily an increasing supply. When you look at general medical settings or juvenile justice or child welfare, very little there. The end result that we're seeing is people going to emergency departments. We're seeing increases of 24% for children ages 5 to 11 in mental health visits and 31% for children aged 12 to 17 in 2020. So it shows you that the pandemic right after the pandemic, we were seeing a lot of mental health related visits, but they were going to emergency care. If you look pre-COVID-19, the trend had been for Black children to have the highest rates, but Latino children were showing the largest increase from 2019 to 2020. I'm now going to move to context because this is what my talk is going to be about, considering the context of minority youth and how it really has an impact because of many reasons that are not necessarily race, but are more that they reside in economically disadvantaged neighborhoods and experience high levels of stress. And we know that stress impacts the development of children's brain development. And this is so important in terms of creating youth that have an opportunity to thrive. Those that live in families with a lot of stress, and this is what we're finding so much in the youth that we work with, youth that are seeing their families with food insecurity, housing instability, and a lot of adversity. And very young, they're confronting those problems in their living circumstances. We also know that psychopathology is linked. There's great work that has been published on how it's been tied to discrimination, to racism, to a low social position. And I want to emphasize low social position because this is where I think it's one of the targets, low social position and how people self-perceive. We did work with Ron Kessler and David Williams and a group of people showing that actually what really was the best predictor, the best associated factor to high rates was low social position. So I really think this is a target of investment. The other thing we think is that in this context, many of the youth experience a lot of exposure to violence, and the negative social mirror of uneasiness of relating in social situations, partly because they have to be under hypervigilance. And I'll show you some quotes that the youth say about this. I'm going to pass to a study that we have been conducting over the last, well, we actually are still doing the papers on this study, on the Boricua youth study. I was incredibly fortunate to work with Cristian Duarte, who's there, and Glorisa Canino at the University of Puerto Rico to run an NIMH study, the Boricua youth study, on trying to understand how the minority status and its potential risk for mental health, looking at Puerto Rican youth in the South Bronx and Puerto Rico. This is a study looking at context. And what I want to say is this is was a great opportunity. Hector Bird and Glorisa Canino had run the study looking at the development of antisocial personality and looking at this youth in these two environments. The youth of low income in Puerto Rico, in the main area of Puerto Rico, and then the youth in the South Bronx, who both share many risk factors for depressive disorder, generalized anxiety disorder, and psychological distress. What differs between this youth, one of the big differences is one group is a marginalized ethnic minoritized group in New York, and the other is an ethnic majority in Puerto Rico. And we published some work on this, on the effect of minority status that I'm gonna cover with you. I also wanna say that during this time, many things happened that really help. You know, this is why I think you need a village to do this work. You know, Marta Tejas Tienda had done a fabulous book talking about how to study this phenomenon of context, of minoritized identity. And at the same time, Garcia Cole had done a great conceptual model talking about the same things I'll be talking to you about: social position, about social stratification, about how this minoritized youth are marginalized and how it has an impact on their well-being. It also talked more about protective factors like family and kin networks, and how the life that children were exposed, these minoritized children in their neighborhood, would have an important aspect in how they do either flourish or really not thrive. But one of the other things that I think this model was very, very important in doing was talking about assets, how most of our work, and I include my own, has really focused on the negative and done a very negative narrative of our minority and minoritized youth. So she really wanted to balance it and also include things that before had not been covered. I want to say this is the Boricua youth study. Cristian Duarte has a great paper on the methods, discussing the methods covering the work that Glorisa and Hector Bird did in waves 1, waves 2, and 3. And then the work that is now going to be presented here, which is wave 4. I want to tell you a few things that are important about this study. First, it has a huge sample of youth, so we can really look deeply into mechanisms that might help understand the reasons why we see differences across the groups. It also had very high retention rates over the 4 waves of data. And we really were able to identify at least one parent. So we have the model really includes not only youth and young adults, but also it includes their caregivers. One thing I wanted to discuss about the analytical framework is that it really, because Glorisa Canino and Hector Bird had done such a wonderful job of including a lot of the constructs that we wanted to include based on Garcia-Colt's model. So we were able to add a lot of these measures in our analysis and then look at outcomes. And most of the outcomes we're looking here, this is a National Institute of Mental Health study. So this, and then Christian Duarte had a grant from NIDA. So most of them are really negative outcomes. I have to say that our main hypothesis, and I'm not going to go through all of it, was that when the minoritized status that youth have really transforms their social interactions in their neighborhood, it amplifies the stressors in a way that in a majority environment probably does not happen. And even in waves 1 to 2 in the Boricua youth study, already when youth were describing what they experienced, 29% of youth in the South Bronx thought people didn't like them because they were Puerto Rican, as compared to only almost 16% of youth in San Juan, Puerto Rico. So very different. I also want to talk about methods, because this is where looking at the work of Michael Rudder and Marta Tienda was very useful in designing the study. We tried to mimic a randomly assigned Puerto Rico youth to the 2 environments by implementing a quasi-experimental design with propensity score weighting as a way to try to identify what were the potential mechanisms to mental health outcomes. And here I want to give a huge salute to Patrick Shroud, who has been the methodologist working with us during, 25 years, I think. He worked with Glorisa and has become a dear friend. And it is through the wise knowledge and guidance of Patrick Shroud that we did all of this analysis. So in this analysis, we do estimated effects by comparing the predicted outcomes that are generated from regression equations between the treatment, which in this case, we're gonna call the South Bronx, and the control, which would be Puerto Rico. We applied composite weights in those regression equations to really see if we could balance the groups on those things that we thought could matter. And then we eliminated from waves 1 to 3, any of the children who had depression or anxiety for our wave 4 analysis. And I'm gonna show you here the propensity weighting. The left is without propensity weighting and the right is with propensity weighting. And you can see there that after the propensity weighting, the groups look fairly similar. I want to also discuss very quickly the 4 potential mechanisms that we were trying to look at. As Lisa was saying, I'm incredibly interested in environmental and social context and trying to understand what is the subjective experience of youth in terms of their social interactions in those neighborhoods. And we also look very closely at the cultural context and minority stress factors, issues of acculturations, experiences of discrimination, but also things that had to do with assets and protective factors like our parent and peer social relations, like parental warmth, or also the risk like parental vulnerability or child exposure to adverse events. These are the results that you can see here. And basically you can see here how the rate of lifetime MDD diagnosis over time, you can see how it increases dramatically now that children are approximately between 15 and 26 years of age. And you can see the difference in the green light, which is the minoritized environment compared to the blue line, which represents the majority environment. I also want to show you rates of lifetime, and these are adjusted after taking into account all the other things of generalized anxiety disorder over time. And again, you can see an increase in the green light for the minoritized environment compared to the blue line for the majority environment. When we look at the analysis trying to understand what could be the explanatory pathways for these differences in outcomes in both in depression and anxiety, we see that perceived discrimination, as others have found, particularly neighborhood discrimination, minority stress, unfair treatment, and then cultural factors as ethnic identity. If children feel they identify with their ethnicity, or intercultural conflict, which represents differences in cultural views between their family and themselves, all appear as mechanisms of potentially explaining the difference in risk and for depression and anxiety disorders and symptoms. And then the other thing is peer supports seem as a very strong buffering mechanism that can ameliorate the experiences of discrimination and rejection, and that can facilitate a sense of belonging. And also, this is an area that requires attention in terms of intercultural conflict with the family. So one of the things we wanted to understand is we know that where youth reside impacts their mental health, but how it does and whether it differs by residing in a minoritized or majority context, this is something that we didn't know exactly. So we wanted to test to see if we could isolate early risk or protective factors that might operate differently. And since we had 4 waves of data, we could see how this difference played out. So we just recently published this paper in the Mailbank this year, showing that, and I'm gonna quickly go through it, showing that some risk and protective factors seem to operate differently in this different context. So for example, higher discrimination and social position appear to be more powerful risk and protective factors in the minority context, whereas positive peer relation seem to matter more in the majority context. And so it might be that for certain things, we need to tailor how we're gonna go about thinking about, are we addressing youth of color in a minoritized context or in a majority context? Let me show you in more detail what we found. It's really interesting that although perceptions of social status was significantly higher in Puerto Rico as youth, this is youth's own view of their social status than in the South Bronx, even under conditions of poverty. But what really was important is that the higher social status was not significantly associated to a decrease of risk for anxiety in Puerto Rico as compared to the South Bronx, meaning it really mattered more in the minoritized environment, social position than in the majority environment. Similarly, the peer relations were protective in anxiety in Puerto Rico, but they didn't seem to be so protective in the South Bronx. And we wonder if that has been, where there's more diversity and less homogeneity, there is more what people call the hunkering down. Similarly, in the minority context, we saw that although the rates of discrimination were not significantly different as reported by the youth in the two sites, discrimination had a stronger psychological, had a stronger effect on psychological distress in the South Bronx, but not in Puerto Rico. And similarly, as I said before, higher social position was protective of anxiety in the South Bronx, but we didn't see that effect in Puerto Rico. But I want to show you not only the quantitative results, but how youth talk about their experience, because we don't think it's being minority or majority exactly like that, but actually the cognitive and affective experience of being minoritized in that context that put them at risk. So let me show you 3 examples of how you see the world very differently. And we were very able to do qualitative methods. This is a mixed method study where we could go back to youth in those 2 environments in the South Bronx and Puerto Rico and inquire about how they saw their neighborhood, their personal and social experiences, their family structure, how was the life in that neighborhood, what were the advantages and disadvantages, their sense of belonging. But what we found are distinct differences across the 2 groups. Let me show you some quotes of youth about the exclusion in a minority context. And I think this is important because it captures the lived experience that numbers cannot show. So just because we come from our environment, people quickly count us out. Everybody counts us out. Sometimes if I meet somebody new and I tell them I'm from over here, they will think different of me. One time, and this is in regards to the minority context, one time I had told some girl that I was from over here and her mom hid all her jewelry in the house and stuff from me, like I was some kind of thief or some shit. People sometimes discriminate. It was very difficult for me to get a job, and I thought it was because of the address I was writing in. I changed the address and quickly got hired. I would drop my resume when I was 18, 20 years old, and they never called me, never. I once used my aunt's address and they called me. So you can see how it gets under the skin of youth. I want to show this one in terms of how youth describe who they are. In the majority context, youth typically talk more about their national origin, about identify myself as Puerto Rican, or I always felt that I'm from here. As I was born here and stay here, I always felt I'm from here. In the minority context, youth use more race or skin color or ethnicity, and even national origin, but they would talk more about I'm Black too, but I'm Spanish. Like when I walk through this halls, you hear my last name? Well, Spanish, definitely. Okay, I'm Hispanic Latina, I'm light, I'm white. I said I'm Spanish, I say I'm Black. So people had the race component a lot more embedded in their self-perception on themselves. But I also want to show you this experience of how both groups describe gated communities as an example of how you can see very similar structural factor being a very different interpretation of what's happening. In the majority context, Puerto Rican youth talk about gates as really the gold standard of neighborhoods that would give neighborhoods and residents safety and security. They talked about controlled access as being the best way to make sure that people don't come in that are going to be related to crime effects. In the minority context, this is how youth talk about it. And this is a quote: with a whole bunch of gates, it's like a jail. It just used to not look like that back in the days. But when they put all of those gates up, it looks weird, like a jail. Like, who wants to live there? Like, you're trapped, but you're not safe. Gates don't make things safe. So very different experience. So overall, what did we learn from this, Boricua study? We learned about the importance of building positive social cohesion in the population as a way, to be a health, as a health target for what we want to do next. But I also think that it really showed that many of these factors are neighborhood and actually issues of the system that need to be changed to be able to combat discrimination and social exclusion. That we need to change this minoritized status by really expanding the capacity for communities to have opportunities for their youth of color, making sure that they have positive social interactions and that they can feel that they have a higher social position. I also want to say that one of the things that we saw in this study is the low rates of mental health service use by both youth in Puerto Rico and in the South Bronx. So now I want to move you very quickly to where we are. I think as you age, you became a lot more risky. And this is funded, that was given by the W.T. Grant Foundation in New York. This is, basically a study that we're doing on leadership, engagement, activism program for youth of color. And let me show you why I think this is a very different way of doing research. And I'm so sad I learned this so late in my life as a researcher. And it's, we tend to think we know what people need and tend to think we really can interpret what's going to be best for them. But there have been very few studies that have been co-created with youth of color to reduce disparities, asking the youth what would be what you think would work the best. And that's what we did here. We wanted to see, first of all, how we could go from understanding to reducing inequality among youth of color. So what we did is we wanted to look at social interactions as they happen in the neighborhoods, in these neighborhoods where youth of color reside. And we wanted to see specific experiences that youth could talk about their social interactions, and particularly how their racial, ethnic, minoritized status could impact their mental health. For doing the study, we decided to go with photo voice because photo voice is such a powerful mechanism. One, it is one where youth can identify, represent, and enhance their community and really show what they see, how they're perceiving that community, how are they living that community. They can record what's happening, their concerns through photos and talk about them in really writing a little bit about their photos and what inspired them to take those photos. But those photos also help for creating a critical dialogue and knowledge about what is happening in that context and how are youth experiencing in a way that can be presented to policymakers. So what we did is we actually got funded to work with 80 youth to provide them with 4 trainings. In each of the 4 trainings, youth would bring 10 pictures each and talk about the 4 pictures. And this was in 4 different communities in Massachusetts. This was Charlestown, East Boston, Chelsea, and Revere. They're all communities with very high rates of youth of color. What we wanted to do first is do the photo voice in the first year and a half. And then in the second half of year 2, we would really go back to the community and show them what the youth were talking about themselves and about their communities, and then do key informant interviews of what they thought we should do about it. And finally, working with youth, develop an intervention that was for youth of color. I want to show you how youth told us that people saw them. They said the first thing is, it's hard to live here when people see you with these labels. As for example, evictions in East Boston, or opioid crisis that deepens in Charlestown, or people die of overdoses in Chelsea, or teens are dead in a shooting, or MS-13 gang members, or people are stabbed. So they said that that was really, really hard. Let me show you a photo that really depicts very clearly the segregation that came up even in the first training. As youth, we asked them about their neighborhood. They actually went to a map and made us very clear about the segregation in their neighborhood. And this is in Charlestown, which is a 1.4 square mile in a Boston neighborhood. And kids were talking, it's segregated a lot. It also goes back, the upper class people only could live in places like Newtown, and Mission and African Americans would live in the projects. And they really depicted where were the projects, where were the people from Newtown, and how differently they related. And then as it says here, the projects and Mission, there's been fights, like literally fighting just because they think they're better than the project. So people didn't go from one place to the other. This was so impactful to the people from the community that they decided to do a vigil of everyone walking across all the community in saying that Charlestown should be for all, not segregated as it was. This is about another youth talking about gentrification and how he perceives gentrification making a big impact in his life. Everyone in Chelsea is like a family, and just seeing someone you don't know and haven't seen before, it just makes you feel weird. It's like 50-50 anger and confused. Why would they build a hotel in Chelsea? Why can't they use the money for something that would benefit the city? Chelsea is mostly a Hispanic and Latino community. And then once you implement a hotel, there are many white Americans coming in. This is just to show you, I want to show you how the youth presented their photographs in this big slide. And you can see that there was a lot of similarities in what came out of the photo boys, but there were also some difference, really raising the importance of context in being necessary to tailor how you're going to go about. We did thematic analysis of all of the interviews that we did with the youth, and then presented it to the community for discussion. And this was also accompanied with a lot with quantitative data that we got from the Youth Risk Behavior Survey, and also from the Community Health Needs Assessment, where it showed that behavioral health was a priority. This is why we thought, based on all of this, we would go to a mental health intervention. But little did we know that the youth did not want a mental health intervention. They talk about their mental health being affected by the challenges and the lack of access that they could have in their communities, and not necessarily seeing them as the people that had the problem, but the community as having the problem that they wanted addressed. They didn't want more mental health interventions. They thought it's not us, it's actually what's happening to us. And this is a very different way of seeing the problem. So we went through their assets and their challenges in each of the sites, and then selected 2 sites to work with them. I have to say, I learned so much from this study, because it really helped us see what was feasible and acceptable for youth in those contexts, how photo boys illustrated their everyday circumstances in a way we had not seen, how we were seeing the world through the eyes of youth, rather through our own researcher viewpoints, and how we have to try to focus not only on the problems, but on the assets that youth have, and trying to see how we could inspire and help youth, empower them to really use their best for changing their communities. And that's what they wanted, and wanted to get more buy-in from their communities and families to bring what they see in their communities. So this is the program we developed with them. It's called Leadership Engagement and Youth Activism Program. And the importance of this is youth saying, we want to work on civic action and civic engagement to bring accountable those people that are in charge of our communities, to make them respond to the community in ways to resolve problems that youth have. It's important to get adults invested. It's important to get the problems that affect youth, and especially their mental health. So together with the youth, we developed this curriculum. I'm not gonna go too much in the curriculum, but it's really learning. Youth started to learn about their communities. They started to interview people in the community, and they also developed over the course of the program, a plan, an action plan of what they needed to do to have actions toward the problem that they were seeing. As a result, they learned about youth leadership, about youth-led movements, how many of the things that have happened in this country have been led by youth. They really started hearing about the importance of listening to others, interviewing and communicating and seeing different perspectives. And then also how making a plan is not so easy, and carrying it through is not so easy, and then working in a group. The result was creating a logic model that really helped youth see about leadership, engagement and development, about developing civic values, about civic participations and skills, but also the importance of trying to see whether this leads to well-being, to youth having a sense of purpose, which they outlined was significant, to some more self-efficacy and better peer relationships, with the hope that that would lead us to more well-being. The final curriculum that was developed with the youth has 14 sessions. 7 are led by an adult facilitator, and then the last 7 are actually all led by the youth. And you can see here, it's really getting to know each other, creating social networks, creating civic engagement, but also communicating better and really understanding other community stakeholders and their role, so that they can plan and accordingly learn about what they can do and then take action. So we learn about the importance of the voice of youth, of how neighborhoods have a central role, and I've been working now more intensely on what can we do at the neighborhood level, and developing programs that really join academic and youth partnerships to make sure that we align to the goals. So I want to show you in this slide, I want to show you very importantly, one of the examples that was done.
The rising cost of housing in East Boston. What's the issue? Why is it important? And how can youth be involved? Who we are. We are a group of youth in the Youth Civic Engagement Program, and we've decided to tackle on the problems of the East Boston community. We went through a variety of problems we found to be important, such as safety, lack of high schools, but in the end, we chose the rise of housing prices in East Boston.
Information about the problem. Boston has the 3rd highest rent in the country. Boston has the 6th highest housing prices in the country, and Boston has the 8th highest population of homeless people.
So why is the problem happening? Well, as many people know, Boston has a high concentration of great colleges like Harvard, MIT, all of those are nearby. Also, Boston has great tech jobs, which also cause people to want to come here. And also the historical sites here are in abundance, considering this was one of the first cities founded by the people who came to this country. So lots of people end up coming to Boston, therefore the rent increases.
Why does the issue affect East Boston? 54% of people in East Boston are first gen versus 32% in Boston. The median income per household is about $50,000 in East Boston versus the median of $62,000 in Boston. And 71% of homes are renter occupied versus 65% in Boston.
Why does the issue matter to us? Well, many of us have friends moving out of the state to other cities and parents who are struggling to keep up with their rents.
Your video's not showing.
We just want everyone to have a right to housing and everyone to be able to live comfortably anywhere without.
I'm sorry, I wanted to check. Are you saying that you can't see it?
Yeah, the video was not showing.
I'm sorry?
That's correct. The video was not showing, just the audio.
Dr. Alegria, we can just hear the audio. It's just a black
I'm
square.
sorry.
That's okay.
Let me go back.
Maybe it has something to do with the fact that it's in presentation mode, because I know it was working before when you were just sharing the slides with us without it being in presentation view.
Exactly. Okay.
You can share it just like that, yeah.
I don't know if now I tried putting it there, but for some reason, this is, can you see it now?
You're not sharing your screen right now.
No?
You stopped sharing your screen.
Okay. I'm sorry. I don't know why it's not showing. Only the audio. Let me stop it.
Dr. Alegria, you weren't sharing your slides, so try, you'd stop sharing, so reshare and then see if it works.
Okay, thank you.
Youth be involved. Who we are. We are a group of youth and youth civic engagement program.
It's working, great.
We decided to tackle on the problems of the East Boston community. We went through a variety of problems we found to be important, such as safety, lack of high schools, but in the end, we chose the rise of housing prices in East Boston.
Information about the problem. Boston has the 3rd highest rent in the country. Boston has the 6th highest housing prices in the country, and Boston has the 8th highest population of homeless people.
So why is the problem happening? Well, as many people know, Boston has a high concentration of great colleges like Harvard, MIT, all of those are nearby. Also, Boston has great tech jobs, which also cause people to want to come here. And also the historical sites here are in abundance, considering this was one of the first cities founded by the people who came to this country. So lots of people end up coming to Boston, therefore the rent increases.
Why does the issue affect East Boston? 54% of people in East Boston are first gen versus 32% in Boston. The median income per household is about $50,000 in East Boston versus the median of $62,000 in Boston. And 71% of homes are renter occupied versus 65% in Boston.
Why does the issue matter to us? Well, many of us have friends moving out of the state to other cities and parents who are struggling to keep up with their rents. And we just want everyone to have a right to housing and everyone to be able to live comfortably anywhere without having to worry whether the next paycheck they get is gonna get them through this month.
How can youth get involved? Youth can get involved by attending community meetings, understand the problem and do some research, find people who share common interests and organize, and spread this information to other youth, and share this video.
Historically, a number of movements were spearheaded by young people, and you can make that change too. Don't forget your opinion matters and make sure your voice is heard.
So thank you very much for inviting me to show this, and I'm very happy to answer any questions.
Thank you so much, Maggie. That was amazing. And I think what a way to end with, I think, solutions and empowerment and inspiration. I think, I mean, I know I have the right to, I've been given the right to ask the first question, but I want our community here I want to empower our community to ask questions. And so I wonder, Kate, if you've seen anything in particular in the Q&A that.
Yep. Absolutely. There's a few questions that are coming in. So this first one is from a trainee. Thank you for your wonderful talk. I wanted to ask what you think about incorporating or collaborating with the Big Brothers Big Sisters nationwide program to increase access to mental health clinicians to children in unserved communities. Would this be a good idea to work as clinicians in non-clinical roles to achieve the same goals as mental wellness?
Yeah, that's a great question. And I would say, yes, we are working. One of the organizations with whom we did this work was actually Girls and Boys Club. So yes, they were very interested in working with us, and youth organizations, I think, are an opportunity. I love the idea of bringing mental health providers and also community health workers to be able to work in youth organizing and youth serving institutions or agencies, because I think we need to go out of the clinics to serve youth of color where they are and make it very easy for them to get this. But, you know, I think also the issue of mental health, there's so many things that could be done at the community level beyond mental health services that have to do with really offering, empowering youth to try to offer socializing, for example. They said they wanted more socializing. One of the groups decided they wanted to create a room where they could socialize because they feel so isolated, given the places where they live, the safety issues. So I think we have to think both on continuing the clinical care and moving the clinical care to the community, but also empowering people in the community to identify what sources of help they would want to do better.
So I'm going to follow up on that just because I think you put your finger on something that I was really thinking about while you were talking, which is the minute we talk mental health, it's as if we're characterizing or making attributions about the problem, right? That it's mental health problem, right? And what they're telling us is not a mental health problem, right? That it's a community problem. So given that, and given the stigma of both mental health disorders and the mental health providers experience as well, how do we how do we navigate that and try to both, you know, understand the extent to which it's not mental health versus, you know, helping the, you know, having a place where it belongs in terms of when it is a mental health issue.
Yeah, I think you're exactly where I'm going. And we've actually written a paper. We're waiting for the last revision of that paper to see if but it's actually looking at all the things that we already know. There are very good programs that have been tested as being in the community, being related to the community. For example, parks, green spaces as being very central in how people socialize and have a better sense of well-being, and how people have even designed parks as an area that has been absent in many of these communities. People have talked about the importance of child lunch, food security, as having those universal programs that really make a tremendous difference if they're universal, for then people to have less food insecurity, because that's not an issue anymore. So there are programs at the level of neighborhoods that could be put in. And actually, I'm very glad that there is now a federal mental health initiative to deal with the crisis. And ideally, supposedly $700 million. $700 million, according to what they have said in terms of putting money for all of these programs. So I think it's one of the alternatives we have of moving also to change these communities that don't have a lot of resources for their youth and have issues that we have to deal with. For example, one thing that I've been hearing a lot from the youth, and we also heard it, is the surveillance that there is because of crime that is really limiting the possibility of social interaction for youth in these communities. And so we have to think about the environment and the context as really central in how we can change it to optimize the opportunities of youth to do better and flourish. Jobs, youth talk so much about the lack of being able to get jobs because they're identified with, they're identified as coming from a community of poverty, and that they might be, like the youth said, you know, they might, that girl said, they might think that she's gonna steal from them. Things like that, that youth have to hear day in, day out. So I think we need to change and provide more civic engagement and civic leadership in these communities as a way to empower youth.
Great, thank you.
So we have many more questions that I think we're going to be able to get through today. So what I'll do is I will copy these and send them to you so that you have them. So a few people have asked, just kind of questioned whether or not this program is going to come to the Bronx. So maybe something to think about. Collaborations here, and a lot of members of the audience are interested. So this is a question from Jessica Dodge, who's a trainee here, and she notes that she's curious about how the schooling system impacts in Boston impacts the experience of minority children, if at all. She believes schools are not based on the community or where the children live. And so just wondering if you could comment on that part of the environment, the context.
Well, one of the things I'll say is in testing, in doing a very small pilot of this program in Medco, which is the biggest program moving youth of color to sort of magnet schools. They really like the program. I have to say, they really like the program as an opportunity to voice what they felt, but have not been able to say so much. And so I think in terms of schools, I think schools are not necessarily well poised, many of them, to deal with the issues of racism and lack of opportunities. I mean, I think schools are starting to deal with it and starting to bring that on, but the organizational change that's needed it's going to take time. It's going to take a lot of time in terms of training. It's going to take time in terms of, so in Boston, we had mixed, there's great work that's being done by the Identity Program and other programs that have been done. Adriana Tumala is doing a great program, but we also have a lot of needs in terms of long trajectory of racial and emotional segregation for this youth.
That's a really important point of sort of emotional segregation. A lot of comments around the importance there, commenting on your ability to engage the community and sort of questions around lessons learned during this process. What are other ways in which we can engage community stakeholders to develop programming that's going to be acceptable to the communities that we're trying to serve?
Yeah, that's actually a really important question, and one we are still struggling with because it's very, very intensive, way more intensive than we thought it would take in terms of working with all the youth organizations, bring them over to the DRU, working with them in terms of seeing what was the historical path, having them talk to each other, which I think some of them had never necessarily talked to each other in terms of what could be done. I think we still needed, these are studies that, and you need a long time. You need a lot of effort. And I also think you need for the government, these localities to have supplemental funds to maintain them. These partnerships that benefit both the community and the academic partners, because we're both learning from each other. Lessons that we learned, wow, we underestimated how much effort it would be and how much time. Second, I think having more communication with them. We had a lot of people working the communication aspects and going back and forth. So but I have to say the youth organizations are so interested in doing this work that it's just perfect. It's a time for bringing it on and helping and supporting them, because the youth themselves decide what's the project they want to do. It's not decided by the adults, it's by the youth.
So that actually kind of links to another question in the chat. Just the process of engaging in the co-creation process, the process of engaging youth in, I mean, how, can you sort of give us a little sense of the flavor of that?
Sure. So the youth do, in the photo boys, there's a lot of things youth talk in their photos about what they're experiencing, how is it happening, etc. We analyze that data, we bring it back to the community. The community reacts to, do they agree with what the youth are saying, what things they didn't understand, what things they want to learn more about. So there's a community group, parents, people from the Chamber of Commerce, people from the faith groups. So we had lots of people, policemen from different areas, come and see what the youth are saying. And then we go back to the youth. This is where we said, well, what are the things you want to do after doing this work? And they said, we really want to work with community. We don't want you to do, we don't want a mental health intervention. Please don't do, that's not really where we want to go. So then we brought them ideas like, this ideas about activism, which many of them really had heard, because in inviting people to talk to them, they had talked to youth that were doing activism. And so they were really interested in that as the way to really deal with the problems that they were confronting. And that's when they asked us for more in that direction. We actually did a lot of literature. I have to tell you, this was like a huge learning curve, because this is not what I expected. I expected to do something more in the realms of what I had done for adults or for older adults, but nothing like civic engagement. So we actually got great consultants in this area, brought them in, and sort of talk to the youth about potential ways of putting the things together. After doing that, we actually went ahead and put it together. There's actually a great paper by Amanda Nemoyer that was a postdoc during that year. She wrote about the process of developing that. And what we found is that then we started testing the things we were going to include in the curriculum. And then after we tested them, we asked the youth, what will you do differently? So they came back and said, well, you know, there's not enough breaks. We need to know each other better, because they were coming from different neighborhoods. Not all of them were living in the same area or knew each other. So they talked more about more interaction with themselves. They said, we don't want so much blah, blah, blah. We really want interactive aspects. So that's why, if you see, this is a very interactive type of program where youth are really not only reacting, but also engaging, because the 7 last sections, are led by youth. And that's what they said. We need to be empowered, and you can help us become empowered, but we should be driving this.
So relatedly, so this sort of focus on co-creating with the youth, but a few questions around the involvement of family, of the youth's families in this process, but also kind of their openness and receptivity to hearing about mental health and thinking about the mental health and mental well-being of their children, just given the amount of stigma that's often around, you know, mental health disorders.
Yeah, there was some concern about there was some concern in the parents about, is this because my son or daughter has a mental health problem? And we clarified that no, we were talking about high rates according to behavioral risk profile from CDC in that area, but it was not tied to their youth. That really helped parents see this as a local problem, not as their son having the problem or their daughter having the problem. However, the issue of stigma is incredibly embedded in the interactions people have had, thinking that, you know, are they going to take my children away if I say something about mental health? Is this going to be something I'm going to be sent to child welfare services because I'm not treating my child well? There's a lot of concern and lack of partnership, I think, between the mental health system and this community. So I think it's a great opportunity of trying to partner more. One of the things that happened as a result of this project, as I was saying in one of the sites, actually the mental health providers decided to walk around that area that I was talking about, Charleston, and go meet the community, go hear about what they thought, and telling them that we are here for you all, not for only some. So I think moving out of the clinic is so central if we want to engage and give a different feel of mental health as a community opportunity, not as something that people have to do.
But it sounds to me like what you're saying is that in your experience, if I mean, the psychiatrist is you know, there's a lot of psychiatrists in this audience, right? And it probably isn't a great use of resources, excuse me, to have these psychiatrists trying to be community activists. I mean, in their workday, like we need those people to provide services, right? Or I mean, you can do both. I guess that's part of where I'm going, that how do we make sure that we use the resources for mental health resources for the people that really need those services, but also, you know, partnering so that we're contextualizing and really genuinely offering those services to people, and in a way that they might actually, if they need it, they might actually be willing to use it. So what I'm hearing is that by engaging with the community and talking and listening, that might have even the fantastic, perhaps initially unintended consequence, but important consequence of really building better relationships so that people who need services would be willing to consider it.
Yeah, I think it's at two levels, Lisa, because I think there is the level of it's like this is something that happened in the schools. I remember when I was doing some work a while ago at the schools here in Boston, parents used to say, well, I'm called at the school when there's a serious problem of my child. I'm never typically called for anything else but problems. So the expectation of having a good partnership with schools was not that great. I think the same thing happens for mental health, that we only connect when people are in crisis.
Mm-hmm.
And that's not the best time to make an alliance or even feel that you have a relationship. It's like trying to do everything on crisis. So I think we need to start creating bonds and social cohesion. It's not that I think psychiatrists, we are in a shortage of psychiatrists that's extremely serious in this country, extremely serious. But I also think we need to make the time to not only be working on a crisis mode, because that's not going to be good for psychiatrists themselves, nor for the patients or clients that they see on an everyday basis. That's what I'm saying, that we need to try to see how we move some of the things to an environment that's more rewarding for the psychiatrist and more rewarding for the client, because it's done in a conditions. I mean, we see a lot of, I'm doing 2 other clinical trials of people that have more moderate to severe issues. We work a lot with community health workers that then work with psychiatrists to then work in the most serious of cases so that we can triage, but also having time to establish a relationship. Because I think I'm worried about especially youth not wanting to go to care. You're on mute, Lisa, sorry.
It's not or, it's and, in terms of our role.
Yes. It's an and. We need to do both.
Mm-hmm.
Yeah, and some people are saying, it is tough. This is a tough situation, particularly after the pandemic, where everyone was in crisis, not everyone, it was really, really difficult. But I think now we have an opportunity of trying to see how with this $700 million that are supposedly coming for a federal mental health crisis plan, and the money that's being moved to communities, I think we have an opportunity to reimagine what could be there. I think we really have to not keep the pedal on what we're doing, because it's just not working. It's just not working.
Okay, I'm just keeping an eye on the time. Maybe we have time for one more question, but these are like heavy questions, so I don't know if you can cram the answer into 2 minutes. Okay, so here's one. Maybe you can kind of just start to think about this. I would love to hear Dr. Alegria's perspective on how overt and covert racism impacts mental health and mental wellness in the minority youth that she's worked with. If there's something that she's brought up in any of the studies that she's conducted. And
I'm sorry, COVID? Are we talking about COVID?
No, overt and covert racism.
Overt racism. Oh, absolutely. I mean, there's a work that I have been mentoring Irene Parks, and she's done a great work on racism and trying to understand how racism works in youth, with anger being the actual apparent mechanism by which that racism translates to anger and has a big impact in terms of mental health. And right now, actually, that study is being conducted. I'm PI now of that study. We're doing a bigger study in Indiana with immigrant Mexican youth trying to understand how the mechanisms of racism affect, for example, sleep, affect, for example, the dynamics at school, affect the family dynamics. We're actually interviewing not only the youth, but the mother, the father, and then there's a component of daily diaries, and then there's a component of biological assessments, where we're trying to understand how I think the overt is easier to handle than the covert when it's not explicit, but people do feel it under their skin. Because if you sort of see people following you I've only had that happen to me once in a store, but I've had friends happen where they went to a store and they were followed. It's such a bad experience. It really gets under your skin. You really feel it, very deeply. And it really makes you question, what are they seeing that I don't? So, I mean, it is a painful experience, but I think anger is one of the things. And yes, there is great, the Lancet Psychiatry wrote a whole section on discrimination and the impact of discrimination on youth of color.
Well, it appears that we're out of time, and you have really, this has been so inspirational and so challenging to us, and gives us so much to work from. I'm sure you're going to get some phone calls or maybe some emails, because there's a lot more that we want to learn from you. So thank you so much.
Thank you so much. Yeah, thank you, Lisa, and thank you, everyone. I really appreciate the opportunity. And again, this is a team effort. There were a lot of people, including people from New York, Christian Duarte and Clarissa Canino, and people also from Pat Shroud, who was, heavenly in this endeavor. And so, and my team and my husband that bears the brunt of not seeing me. So thank you so much.
Thank you.